Hello, welcome to Arthritis at Home. I'm Kelly Lendvoy. I'm the VP of Communications and Public Affairs at Arthritis Consumer Experts. And this week, our episode is featuring an interview with my colleague and the president of ACE, Cheryl Koehn. We're going to talk about the new, updated, and improved Biosimilar Exchange microsite on our joint health website. Cheryl, welcome.
Thank you. It's great to be here.
So to start us off, before we dive into our microsite, maybe a good place to start is just what is the Biosimilars Exchange and why did we create it?
Yeah, so I think, Kelly, one of the reasons we created this microsite within the jointhealth.org site is because back in 2009, when you and I began sitting around the table with scientists and governments and colleagues in the consumer and clinical world, and the topic of biosimilars came up, it was, we kind of were all looked at each other in quite a quizzical way. Like, what are they? Who makes them? What are, how do they work? All of those questions started coming up amongst our colleagues in these different stakeholder group areas. And so we thought, well, geez, there is a need to explain what biosimilars are in the very earliest days as they were being developed and reviewed by regulatory bodies around the world, including at Health Canada. So we set about to create what we felt at the time, and I think remains sort of a definitive site for fact-based, evidence-based, research-based information for people like myself living with autoimmune types of arthritis, who are not just sort of wanting to learn about biologics, but specifically want to learn about biosimilars biologics. So, and the site explains that, I think, in really good detail and in really reader-friendly language. So it was really based upon need a decade or more ago. And obviously the site has grown quite a bit over the last 10 years, as biosimilars have begun to play a more and more important role in the treatment armamentarium, or as I call it, the medicine chest, for people living with inflammatory types of arthritis like rheumatoid arthritis, ankylosing spondylitis, and psoriatic arthritis, and others.
Yeah, I think from your experience, our experience, would you say that we really fulfilled or met a need or demand for that fact-based information? Because in fact, rheumatologists, other healthcare professionals, governments, ministries of health have all referred their consumers, their customers, their patients to the site.
Yeah, I think it's been, I mean, you always like to see your vision realized and actually do what you thought it could do. And I think that certainly is the case with the Biosimilars Exchange.
Let's take our audience for a visit.
Oh, I love taking test drives. I'm on it. So let's go to the site right now. I think you can see the site. I've taken you first to the homepage, Kelly, so that we can show our Arthritis at Home viewers and Arthritis Consumer Experts members sort of where they will find it. This little thing is sort of covering where the main bar is, but you can get into the Biosimilars Exchange here on the main menu. And then once you're here, Kelly, you'll find a navigation bar for this microsite itself. So the homepage, which is what you're looking at now, which effectively explains what people are going to find, what users are going to find on the site, biosimilars facts. And I just love this part of the site because it really breaks down things into bite-sized pieces and in a nice Q&A, and we'll see more of this in a minute. I think most people who are interested in learning about biosimilars really want to know about the research. And we've got, sort of all of the leading medical science organizations, research literature aggregators such as PubMed, listed here for people to learn about the science, some of which is not in lay language, I will say, but those are external links. Obviously, policy, super important. And this is where people can learn about how provinces and their drug plans are dealing with it, with these policies. And we'll talk about that in a minute. And then, of course, resources. Here, I just love this one because it's just, it's like Jeopardy. You pick a square and you find great information behind it. And then, of course, how to get involved. And so there's some links here, how to sign up for our newsletter, which means people will learn about anything that happens with respect to biosimilars. So that's sort of the main, what we call the sub-navigation bar to our main website here. So I think that gives people a pretty good idea about how they can navigate around the microsite itself.
So something new is that graphic bar under the nav bar. Can you just walk us through that section of the site?
You bet. So as you know, Kelly, we launched the Biosimilars Exchange in its first edition back in 2016. And between 2016 and 2021, the information around biosimilars, which is, again, kind of a niche topic, has really exploded. So we took a look at our existing site, or edition 1, as I call it, and we looked at where users were going the most. And so we wanted to put those front and center for people, Kelly. We wanted to make those, easy to find right at the top. And of course, you know all about our biosimilars, our biosimilar biologics guide. You can download and print a copy so that you have it in paper form if you'd like to have it, though we encourage our members not to print, save the planet if you can. But it starts out with a cool infographic, a nice ordered table of contents, and then, of course, the information itself. And then, of course, that is also linkable here. So it's really something that we're providing that is quite comprehensive. I think it's 20 some odd pages, if I'm not mistaken, Cal. And has been updated and has the latest science. So this is now edition 2 of this biosimilars guide. It has the latest information, the latest science, and also some of the latest policy information. And then you got a peek.
And I'm just one point here in terms of what you walked us through so far.
Yeah.
All of it is also translated, available in French.
Absolutely, Kelly. There is a toggle on the right-hand side of our website that allows people to see things in both English and French. Thank you for reminding me. Everything ACE does is obviously in both official languages in Canada, and easily accessible from the site. The other piece that people use a ton, and I think a lot of clinicians are using this, is the infographic itself. So this is the infographic, and just in pictorial and sort of I call these information snacks. They take a piece of information, Kelly, and sort of bring it down into bite-sized sort of pieces. And this half of it, if you're going to print it, it does print front and back. The front piece talks about biosimilar biologics in Canada, and it gives you the basics. And then it talks about transitioning to a biosimilar biologic. And I know we'll talk about that in a minute, but really this covers what happens when your existing prescription for an originator biologic, so the one you may have started on, is no longer covered by your private or public payer, and then you'll be transitioned to a biosimilar. And that policy has happened in several provinces, and I know we'll talk about that. The next area of the site that was really used a lot was the FAQ. So this jumps you right down, Kelly, into this really cool accordion that talks about, just the questions that are the most commonly asked to us as an information provider to patients and public, but also the questions that our rheumatology colleagues are hearing more often than not in their clinics. So these are some of the basic questions, Kelly. There are certainly more. And if you have questions beyond what are listed here, rest assured the answers will be in the biosimilars guide, which is up at the top here. And then lastly, we have this incredible suite of education videos, and they feature some of the leading clinicians in rheumatology, namely Dr. John Esdale and Dr. Susan Bartlett. Dr. Susan Bartlett talks to us specifically about kind of the nocebo effect, Kelly. So I really encourage people to learn about that. And basically, the nocebo effect is something that people can be influenced by if they're thinking about any kind of medicine in a negative way versus a positive way. So it has nothing to do with the science. It has everything to do with what you're thinking about them and how people are communicating to you about them. We know that in the early days, there were a lot of, I'm going to say misinformation. That's a commonly used word right now in the age of a pandemic. And there has certainly been a proliferation or an abundance of misinformation put out in the early days about biosimilars. And what we hope to do is shed light on that and really assure people that over the last sort of 15 years, 10 to 15 years, both here in North America and in Europe, thousands and thousands and thousands of patients are on biosimilars now and achieving great benefits from them, just like they did on their originator. So we really encourage you to watch this suite of videos.
So you described how the site was launched 5 years ago.
Yeah.
And how the audience has grown. And maybe you just want to talk a little bit about the last 2.5 years, where we've seen the audience dramatically grow in terms of the number of visitors, amount of people who are going to the site, the amount of requests for information we're getting. What sort of has occurred over these last 2.5 years and how we're meeting that need?
Yeah, so that's a great question, Kelly, and thanks for pointing it out, this demand for information. We know that generally speaking, whether it's related to biosimilars or, some new kind of health trend or some business tip, the more the public is interested in it, the greater the demand, obviously, for information. They're going to go seeking for information. And we knew at ACE, from talking to our colleagues in government as they were developing biosimilars policy that affected reimbursement for these medicines, either publicly or privately, would really drive the need. So unless there was more people using biosimilars, there wouldn't be a greater need. We wouldn't have seen a flood of users coming to the site looking for good, easy to read information. But a couple of years ago, British Columbia implemented their biosimilars initiative, which meant that people who were going to be newly started on, I'll use the generic names, let's say infliximab or etanercept, would no longer be started on the brand name. They would be started on the biosimilar. It's a policy called New Start. Because we knew from an abundance of science that that was safe, effective, and super cost effective. So, and the government, when they implemented these things, began to list now new products into the formulary. So we could see how savings were beginning to expand our medicine chest, which is the whole goal of a biosimilars policy: maintain safety and efficacy, make it available to more people, and help grow the model of care, which includes new medicines that come onto market from innovative pharmaceutical companies. So
through the reinvestment, of those saves.
Absolutely, Kelly. And then British Columbia was the first province to take their biosimilars initiative further. And that was to require patients through policy, when their prescription was up or when over a 6-month period, they needed to move from their originator to the biosimilar. And that process went super smoothly for people who had exceptional medical circumstances that said, well, maybe not. So, maybe they shouldn't be transitioned. Fewer than 1% of the people that transitioned requested those exemptions. So people had a mechanism to make an appeal, not widely used because it wasn't really necessary. And now British Columbia has seen, as soon as that policy was implemented, Kelly, we saw new listings for diabetes, for arthritis. The cancer treatment armamentarium was afforded, I think, new medicines, new savings. So it's a way to energize, I think, the ability to put new medicines on, but also do other things like fund nursing billing codes, which in autoimmune diseases is super important. So savings just weren't reinvested into the medicine chest, they were reinvested into other key areas of our healthcare system. So then Alberta followed suit about a year after that, Kelly. Then New Brunswick, and most recently Quebec, has implemented transition or switch policy. All of those provinces have achieved great savings. There have been few to no issues. And the group of autoimmune diseases, I think both the clinicians, so the specialist physicians, and the patients have been working very well together. So it's that policy, Kelly, that has driven the use of our site. People now, because they're being transitioned or because they're being newly started on a biosimilar, people want to know, what are they? How are they used? How are they made? How are they regulated? What do they cost? Are there people on them? What does the science say? Like, all of those questions start to bubble up, and a need for information arises. And we've been filling that need.
Yeah, and as you showed earlier, all of that policy information is in the policy page. So we encourage people to read that and look up their province just to see. Exactly.
So here's a good example. Thanks for reminding me to jump there, Kelly. So here's a good example. In British Columbia, you can hop to their biosimilars initiative for patients. So these take you directly to the site, Kelly. So we're not trying to be an interpreter or some moderator for patients. We want them to get, to go, straight to the information source. So that's British Columbia, their biosimilars initiative. In Alberta, same thing. You can go right to the bulletin that announces the change. And all provinces, by the way, have New Start policy. 4 have both New Start and transition policy. And we expect the rest of the provinces, Kelly, to follow suit, as soon as they can get their processes in place. That's our belief anyway.
The transition policy really sparked the demand for more information. And one of the things, the other ways that we responded was in our resource section, being able to provide references for people who wanted to go sort of beyond what's contained in this site and do additional reading. I think if you go to the bottom of this page, there's a resource section that they can click on.
Yeah.
And that'll take them to some really important information, not just from Canada and the Canadian experience, but also the European one.
Yeah, that's a good point. I mean, most of these things, Kelly, are written at a very high reading level. You know, I would have difficulty, for example, sort of wading through, let's say the EMA pieces or the FDA pieces, but in general, they do have within those sites, they do have sections that are specific to information on the patients. There's information here on how arthritis medications are named. We have a glossary here, again, the FAQ. And again, these are just one other way within the site to find, easily find information. So I think Kelly, it's this microsite, the Biosimilars Exchange, is really sort of soup to nuts. It's got everything. I think a patient like myself, a person like myself who, with living my entire life with a chronic disease, is going to find pretty helpful, if in fact they haven't found it helpful already.
And for our audience, our members and subscribers, it is interactive as well.
Yeah, I think we actually show you ways that you can get involved. We want you to sign up. You can send feedback directly to us, and this just isn't a black hole email box. We actually read them every day and answer them. It might take us 24 hours, but generally speaking, we're responding in really good order. We also encourage people to subscribe, because when there's news about a formulary change, a drug plan change, we're gonna let you know. We're gonna give you the straight goods, as they say, and in easy to understand, sort of non-jargony language, we hope. Sometimes there's just no words but the jargon. And we're constantly trying to stretch the vocabulary so that people can easily understand what's going on. But we really encourage people to get involved and have their voices heard. So there you go.
Yeah,
there's the tour.
And we always encourage people to share any of our materials, and there are opportunities within the Biosimilar Exchange for them to do that exactly, either through email, Facebook, or Twitter.
Yeah, I think I didn't show you that, but you can click on those things, those opportunities, and it blooms an email box with the link in it, and it's really easy to do. I can't tell you the number of times that my friends and family members have sent me things in that same way. They see something that they like, and they, shoot it over to me that way. Also, at the bottom of that get involved area are our social media icons, Kelly. So you can share across Facebook, Twitter. I think that gives our viewers, Kelly, a really good idea about what the kind of new and improved Biosimilars Exchange is all about. And again, we encourage people to go check it out. It's I think we're hearing really good comments about the new look and feel.
Well, thanks for your time, Cheryl, walking us through the new and improved Biosimilar Exchange. And thanks to all of our viewers for joining us this week. And we hope to see you again at Arthritis at Home. Bye-bye.